welcome back to this one more episode of Hall of Fame interviews. In this series, we talk to those couples, doctor or doctors who have done something significant after coming to the academy, and they have actually one step closer to their dream. Okay, so today we have a very nice couple from Orrisa, from Sambalpur, and we really like to talk to people who are from Tier 2, Tier 3 city, and they have done significantly something which is beneficial to larger society. I want to welcome Dr. Smruti Hota and her husband, Shri Dr. Laxmi Prasad, who is a cardiologist, and Dr. Smruti is a mbbs and MD anesthetist. And Dr. Smruti has done a lot of fellowship as well. And after doing senior residency, she started a pain clinic without actually going into any corporate job or something. And that was, I will learn how she was able to take that step, courageous step, and why she came back to their hometown, which is Sambalpur. And same stands for the Dr. Laxmi Prasad also, because he was in cardiology, he was in the PGI Chandigarh in that stream, and from there would be many more options for him to go to Delhi or out of country, because that domain itself opens up a lot of avenues. But they have decided to come to a Tier 2 city, their hometown, and that's an interesting story. So welcome once again, Dr. Pranav. You want to add some words here?
First of all, I'd like to congratulate both of you that you have taken this call and leap of faith to successfully to actually serving your people, and now you are successful. Basically, kudos to you and your efforts, and you are brave enough to come back, because many people think that bade city mein hai, wahan settlement easy hai, and here you have to dug the ground on your own and start your own practice from day one. You need a lot of confidence also to face the patient like in your own setup. It's a unique type of thing. I congratulate you, and may God give you all the strength that you make a big cardiology hospital soon.
They are actually planning for opening a bigger setup. Yes.
So actually, I done my MBBS from SCB Medical College. It is from Orrisa only. After that, I have done my MD and DM both from PGI Chandigarh.
Okay.
So after completing that, we came to our. I have interest in serving my own people. I came back to Orrisa.
Fantastic.
And at that time, Smruti was doing senior residency in anesthesia. After that, she inclined towards pain medicines, as it is a patient-based, and there is chances of intervention and all these things, and some of her recognitions basically. So she started. She done her fellowship in Kolkata from a pain institute. After that, she decided to, because the interventional pain medicine itself is a newer concept, and many of corporates do not understand its scope at present. So there is a lot of scope, but they do not clearly understand its scope. It is very difficult for her to make the corporate people understand what is this. She at that time joined also your Doctorpreneur groups, and she got motivated to do her own pain setup. And when she told me about that, and I told like that, you go on, I'm in the back to support you. So step by step, she initial part, she took a rental house, and after that we basically do the basic setup. We took a construction plan for the pain setup, the basic requirements like a USG machine room and CR room and OT reception and doctor's cabin and some facility for indoor investigations and pharmacy. It's a small complete setup, because those patients who come with pain, they do not really like to go outside to get their blood investigations done, and they also prefer to take their medicine from the. Basically, all the people like to get all the services under one roof.
One roof, yes.
So they basically, we started step by step. We purchased ultrasound machine, we purchased CR, and we all the for radio frequency ablation machine. Step by step, within a period of 6 to 8 months, we accumulated these instruments, and she started her paid practice was both OPD and intervention, daycare interventions basically in that setup. And now the patient response is good. The patients who have got treated, they have a very good feedback. And she is now getting the second contact patients also. Those patients who got, she has also nearby 5 to 6 districts. In fact, from nearby states like Jharkhand and Chhattisgarh area also patients are coming. From she is gradually stepping towards her dream, and therefore she is now planning to have of her own setup that she can do it in a proper manner, and she should.
Fantastic.
So
Great.
also we may think of incorporating cardiac services into that also.
Right.
Yeah, absolutely. You should do that. Yeah.
So great journey, Smruti. You have to persist, and you have to fought all the things which came in between. So tell me about your first patient in your setup. How was the experience?
Thank you so much, sir. First patient, sir, he was I was not that much confident in treating, but after 3-4, gradually my patient load got increased, and I gained more confidence in treating them.
Awesome.
Actually, whenever you start a private practice, it is a fear that whether I'll be able to perform, whether it will go good, or what I'm doing is or not. There is a lot of dilemma.
अब पेशेंट कहाँ से आएंगे सबसे बड़ा इम्पोर्टेंट है
पहला होता है पेशेंट कहाँ से आएंगे अब आ गया तो उसको ट्रीट कैसे करेंगे so basically there is a lot of doubts are there in your mind and it is you should back yourself and then the confidence will come. That is exactly what has happened in your case.
Yes, sir.
Awesome. 1 patient to 10 patient in a day was a very interesting journey.
Yeah, and that too a very short period of time. Dr. Smruti, tell me about like how that digital marketing which you are telling us, how that played in your clinic, and how you are active in social media. What the things you have done that people who are hearing or listening to this interview can also learn from you.
Yes.
And this will also break one more myth that in tier 2, tier 3 cities, digital media does not work or social media does not work. But you are a live example that it works.
Yes, sir. It was a myth that tier 2 city digital marketing doesn't work. Digital marketing works even in villages also, sir. I would like to tell, because initially whenever first I put everything on my Google search engine. That Google search engine, I found a lot of patients from the search engine itself, because many patients, the keywords they used to type pain, back pain, neck pain, then it automatically my clinic address it pop up.
Yes.
And it is at the top also. Many people are saying you are the best doctor here for pain. Like that patient kept coming, and gradually I saw your that video that you told Facebook.
Yeah.
And I think one more thing you told, that 90 reviews in 90 days.
Correct.
That also worked for me a lot, because I asked many patients, those who are coming second time for follow-up and who have a good response with my treatment, they automatically used to give review when I asked them. Okay, ma'am, we will definitely give. Like that, their response is also very good. And the third thing is gradually I have started doing videos, like the procedures I did, and like something about telling back pain, about neck pain, what are the causes, what are the treatments available in our clinic, and it's a short video, like 1 minute or 30-second video. I started boosting those posts in my Facebook page, which got 50,000 view, 40,000 view, like that.
Wow.
And gradually, sir, initially though I was very less confident about speaking also. Now my speaking skills has also been improved after doing 10, 15 to 20 videos.
Yes.
And
it is visible. It is visible you are talking
from the bottom of my heart, because the confidence that brought inside me was just because of you both.
Thank you so much.
Actually, it is your confidence only. We just give you a push. Right?
Yes, sir.
And here I want to comment that this is example of a person who has not only utilized her own skill and personality, but she has used the digital marketing tools, and now it has successfully worked for her. Basically, there is a little bit effort extra which you should do as a clinician. You always keep on thinking that मैंने अच्छे से treatment कर दिया तो everything will be all right. मेरा काम तो यही है, सिर्फ treatment करना है. Additional thing so somebody else will do. But you took your pain to take the reviews, make the videos, and to create some content which was useful for people. These are like necessary skills. You cannot compromise on these. It's a part of your practice.
Yes, absolutely. And what good thing that Dr. Smruti has done is finding that niche, because as an anesthetist, she might have got attached to one hospital or clinic and she might have done some work, but then she find a micro niche, which we keep telling a lot of people that you find your niche, micro niche, and start being number one in that niche, and you slowly develop that segment or that niche. And she has done it perfectly. This is how it needs to be done. And now people see there are 100, maybe 1,000 anesthesists, but there are only few pain management doctor or pain clinics. That is where the gold mine or diamonds are. If you find that micro niche and you can actually do some social media or digital marketing, start giving results to the people, start taking reviews, you can build your own whole empire. So fantastically done. Good.
So can you give some idea that, for example, if somebody else wants to make a pain clinic, pain setup, what all things they should keep in mind, like logistically and also settling the practice? How should he go about?
Okay, sir. From my experience, I would like to tell starting a pain clinic is not that easy, and this path is not that easy. Because it's very difficult to get a permission for an anesthetist for an ultrasound machine. There are PNDT Act and everything is there. With a lot of difficulties, it is finally with my husband's name only I got the machine because he's a cardiologist. Government only gave permission to him, and I can't give a report also. So that is the main drawback. And for a pain physician, ultrasound machine is like a stethoscope. Trying to, because I am a member of that International Society of Musculoskeletal Ultrasound in Pain Medicine, we are trying to resolve that issue also. There are some states we who are very strict with the PNDT rule. Our state is one of them.
Okay. And yeah. Because of the there's a female foeticide is so common in those states. And see, there will be hurdles like what you have said, but you have found a way, and that is how people will find a way. If you are doing it for a genuine case, you will find a way.
See, the system has a lot of shortcomings. If you keep following and telling that system is nahi hai, then you will not have a USG machine and you will not start your practice. Find a way out, because so many things are really not well defined in the health sector as yet. Because see, for you it is like a stethoscope. It is important and required for you. But then nobody has thought about that at the higher level, that you should give the permissions to the pain physicians also. This is a nice thing that you have taken it as a challenge and called bring it on, and then you have fought out.
Yes.
Good.
Next.
And next, the plan that you have given, how much area, what should be how to choose the location and everything, I kept in mind, and I started searching for the place that is suitable for a pain clinic. Ideally, my clinic is nearby. There are so many hospitals and government hospital is there. Many private nursing homes are there. So nearby, many doctors' clinic are there. I choose that place.
So location. What we have told you in the academy, how to choose the perfect location, that you follow those cardinal rules. Okay.
Yes, I followed those and selected one place. It's my clinic, because it's a startup. Because I started only with 1,500 square feet area.
Nice.
And after that, this is just a basic pain clinic. Later, we will include multidisciplinary approach that I am planning, that I have already discussed with you, sir. Later, I will make it to 5,000 square feet area for a pain setup, where multidisciplinary approach will be there. Psychologist, psychotherapist, physiotherapy, all set up. Complete pain setup.
Yes.
Fantastic.
And I think that kind of setup will be the first in not only in Sambalpur but whole Orrisa only.
Yes, sir.
Even pan India level, there are not many setups which deal with this problem.
Yes, one of my teachers, Dr. Pankaj Surange, IPSC, that is in Delhi. That is the only center which is complete setup, pain setup is there.
Good. Fantastic. Very nice story. And whatever pain point you have told, it is fantastic. This is to the point. People will face this. And some people will say that, okay, I don't have wife or I don't have husband who can get this ultrasound machine. Then you have to find your own means. If you
Yes,
think, if you start thinking, you will find some means. And if you are not
can have
using,
some partners, you can have some people working with you.
there could be multiple ways. Only thing that your intention should be pure. You are doing it for things, you are genuine, you will find some other way of serving people. I'm so happy. I'm so happy that you guys are able to do that, and now you are planning for something big. And you have been in the academy for 1 year now. How have been your experience, and what is like your future looks like?
Yes, sir. I hope, with a hope that we will set up our own setup, and definitely you will help us, sir. I know very well.
Sure.
And like that, I have the way I have started, the way you have guided us directly or indirectly through everything, through all the videos, through all the messages, everything that I put in query, you always promptly replied me everything, and you solved all my queries with a very short period of time. And that's why I am able to do all this. And gradually we want to set initially 30 bedded cardiac setup only, because later we will plan for super speciality centers. Yes, sir. But initially my next plan is like to start a 30 bedded hospital with all cardiac facility under one roof.
Great, awesome. So your future is sorted. You are very clear in your vision, what you want, and you are going as a step by step, like what we say, phase by phase manner. Because every phase is like your this is your first milestone. Your dream is yet to come. You are putting the milestone, and you have your things sorted, which is very good, because clarity is one of the values which we keep talking in our inner circle calls, that you should have clarity in your professional, personal, and spiritual life. And that will give you lot of the speed of execution increases, the success rate increases.
Yes.
Awesome. And the last, I just wanted to ask you that the people who are listening, maybe they are in different stages of life, maybe some are younger to you, some are people or elder to you. What advice you will give to those people who are watching, who want to do something, or they already have something but they are not getting success? What is your advice for them?
Sir, only advice I can give that you have to take risk. You have to get the courage to start. Money is secondary. And I mean that जो कहते हैं मन में लगन हो तो रेगिस्तान में भी फूल खिलते हैं, that helps me a lot in my life, and I have applied it in my life. And you have a strong mindset, that Sir Pranav sir and you told me that is the only thing you need to start anything.
I still remember that you just told that when you asked that money was a primary problem, and what we said, what was that incident?
Yes, sir. Before starting the setup, I always kept a thought in my mind, I don't have that much money to start. From where will I get 1 crore rupees? And later, what happened, sir? When I started, it was 1 or 2 patients. I was also tense to how my revenue will increase. Then I started working on it. I followed each and every step taught by you, and gradually, patient kept coming. The revenue started increasing, and now almost 50% of my loan I have cleared.
Very nice, fantastic. It's the courage that you have said. It's the intention that you set in the start. And if you think money will be the problem for everyone, even for the highest industrialist, Ambani and Adani, money is the problem. Even for the smallest startup people, money is the problem. Money is the problem for everyone. The only difference between success and unsuccessful people is about the intention. How strong you want to take, what dream you have, and how fast you implement, and what are the resources you can find, alternate resources. Maybe directly you cannot do it, but you can find some ways to start.
Yes, basically it is about the action taking.
Action taking,
yes. Steps, you have taken the action and you have succeeded. So it is just a view from below the mountain, and now you're on the top of the mountain. Once you reach up, then you realize that, okay, I have come these many steps. It is some things which we are not also thinking about ourselves. Sometimes we are actually self-sabotaging, or you are actually playing yourself very down. You are the person, inspiration in the sense that you should back yourself, and everything is possible. You can move mountains also.
Yes. Mindset is a problem. See, mindset is the only thing. The thing, if we strongly believe that you can do it, you probably will do it. If you strongly believe that you cannot do it, probably you are in the both cases, it is only your mindset that your mind is actually telling you truth. If you change your belief system, which we can change by choice, your future or your present scenario, your outside reality will change. It's a fact. If you if you apply this and you have done it, and a lot of people who are successful in this academy actually did it. It is only first in the mind that you have to believe, and then you find resources, you do action, you partner with people, you find the ways of getting the statutory clearances, and it will be done.
Great.
Great, fantastic. It is fantastic talking to you, and a lot of people will learn a lot of motivational. They will get motivation, and they will get few lessons to start as early as possible. Thank you so much for joining, and keep growing. More power to you, and keep smiling as you always.
Thank you.
If you want to listen to more success stories like hers and get inspired and find out the ways of progressing and becoming a great entrepreneur, please click the link below and join us.
Thank you, sir.
We are doing a masterclass next week. You can register the link below, and you can see how we do things and how we can help you. And if you want to know more about Dr. Smruti and her hospital and clinic, her website link and other details are also mentioned. You can click and see and meet her, ask her any question below the video. We will be able to reply. So thank you so much for watching. Fantastic. See you next week.